Hello everyone. Greetings from RV Aster Hospital, JP Nagar, Bangalore. We are from Department of Neurology. I am Dr. Sreekanta Swamy, Senior Consultant in Neurology, and my colleague Dr. Sowmya, Senior Consultant in Neurology. We are here to update you on some common neurological problem. And every year we celebrate or observe this day, 21st, as a Alzheimer's Day. The purpose of this is to update you about what is happening in this field and what are the improvement in terms of diagnosis and treatment, and how to get these facilities help to your patients or your relatives when they have Alzheimer's disease. And we know that Alzheimer's disease, when we talk about dementia is almost equated to Alzheimer's disease because Alzheimer's disease constitutes most of the dementia part. And nearly 55 million people are suffering with dementia all over the world. In India, it is about 8% of the total population over and above 65 years are suffering from dementia. So it puts a lot of burden on the economical part of a country or globally. In fact, one study shows that 2019, when they assessed it, about 3 trillion US dollar was spent on this disease in terms of diagnosis, management, etc. So that is the amount of monetary burden that it gives. So as the aging population increases, these number of these diseases also going to increase and put more burden. So it is expected that the Alzheimer's disease or dementia is going to increase to 180 million in 2050. So it is important to know this dramatic change in the disease pattern, and also we should be aware of how to identify in the early part of the disease so that we can get proper healthcare suggestion and treatment. So, I will now ask Dr. Sowmya to just give us an idea about what are the common causes of Alzheimer's disease. Dr. Sowmya, please.
Yeah, so Alzheimer's disease is a neurodegenerative disorder. What happens here is there's an accumulation of abnormal protein in the brain, and these in Alzheimer's disease commonly this is the tau protein and the amyloid beta. Now, normally also the brain produces these proteins, but as we age, the capacity of the brain to clear these protein reduces. This is more common, this is more severe in patients with dementia, where either there's an increased aggregation of these proteins or there is a reduced clearance of these proteins from the brain. Now, this could happen because of various factors like environmental factors or genetic factors. So, when there is an increased amount of accumulation of these proteins in the brain, it causes neuronal damage, giving rise to cell death and loss of function of these neurons. And this produces the symptoms of dementia. And this is what is called as neurodegeneration. So, this is what is the main underlying cause of Alzheimer's dementia. So, could you please highlight about the role of hereditary factors in Alzheimer's disease?
Yes, of course. Like any other condition, a small role is played by the hereditary factors also in producing Alzheimer's disease, but it is about only about 10% of the Alzheimer patients can have a strong hereditary factor, especially the first degree relatives if they are affected, especially if there are two or more than two persons in the same family which is first degree relation, if they are affected, it is likely that the subsequent persons can develop Alzheimer's disease more or less very strongly. So that is a very important thing to know. But most of these hereditary related Alzheimer's disease comes in the early age group before 60, 65, and they may not only manifest with memory impairment, but they may manifest with various atypical features. So sometimes there can be delay in diagnosing these people who develop Alzheimer's disease due to hereditary factor. So this much we have to know that there is a hereditary component, but it plays a less role, especially a gene which is called ApoE4. If that is present in a particular person, they are very likely to develop Alzheimer's disease. But reverse is not true. Not all the people who have this gene will develop, but most people who have this gene can develop Alzheimer's disease. So not everybody has to be screened for it, but when we subsequently give some medication specific to Alzheimer's disease, we have to check this according to authorities. They insist that before giving this medication, you have to check this gene whether it is there or not. Then only you have to give some medication. So this is about the Alzheimer's hereditary. Dr. Sowmya, can you just briefly tell our audience about symptoms and stages of Alzheimer's disease, please?
Yeah. So usually there's a stage called as the pre-dementia stage, which starts as early as 10 years before the actual symptoms. Here it is there's a mild cognitive impairment, like it may be very subtle. Patients can usually manage their daily activities very well. They have some occasional word finding difficulty, some subtle forgetfulness, some may have some anosmia. And then the second stage is the early stage. Here, the symptoms become apparent to others as well. They may have some difficulty in going about their daily tasks. And like they are forgetting to take medications, they're misplacing objects. So, this is the early stage. And the middle stage is where the symptoms are much more obvious. Now, the ability to acquire new information is getting affected, and they require assistance from others for personal care and hygiene. There is some amount of restlessness, agitation, and there's a bit of disorientation to time, place, and person. The late stage is an advanced stage of Alzheimer's, wherein there's a time shift. Like people may think they're in different time, commonly a younger, a past old period of their time. They may start asking for people who are no longer alive, and they may have a difficulty in speaking. So the number of words are starts reducing, and there's a lot of anxiety, depression, hallucinations become more prominent, behavior disturbances, and then the mobility gets affected. So now you will see that they are more of bound to the wheelchair, or they're bed bound. And then nutrition, poor nutrition, they can have swallowing difficulties because of which the nutrition gets affected. And they can have complications, like they can develop a pneumonia because of the fluid and the food particles entering into the lungs. So generally these are the stages, and once the functional impairment starts, people generally spend about 2 years in each stage.
To add up a little bit to this, most Alzheimer's disease patients will, on an average, survive between 4 and 8 years from the time of diagnosis. And by itself, Alzheimer's does not kill a person. Its complication kills the person.
Complication.
Like she said rightly, pneumonia, bed sore, etc., poor nutrition, etc. So Alzheimer's by itself will not kill a person. So this is what I wanted to just emphasize
So,
on.
sir, what are the risk factors for Alzheimer's disease, and how can it be prevented?
Well, the risk factors for Alzheimer's disease, the first and foremost thing is the age. Anybody who is 60 plus age is at the risk of developing Alzheimer's disease. Second thing, there are multiple risk factors which are common to both cerebrovascular problems and cardiovascular problems. So these like hypertension, diabetes, obesity, poor nutrition, lack of exercise, lack of sufficient sleep. All these things are known to, even though they are not proved, they are known to be the risk factors, because those who does all these things regularly, they develop less and less of Alzheimer's disease. But in the Alzheimer's patients who have not done this in their younger age, they develop more and more. So that is why they think these are the risk factors. And of course, most importantly, anybody who has got lipoprotein A4 is definitely at the highest risk of developing Alzheimer's disease if it is identified for some other reason. Now, question is how we diagnose the Alzheimer's disease. So, the diagnosis of Alzheimer's disease starts with the doctor's examination of the patient, taking the history in detail, interviewing the patient properly. Along with that, once they do some tests to identify or know that there is a forgetfulness or memory impairment or dementia, then they do some laboratory tests which are important to do for one reason. There are some treatable conditions which resembles like a dementia or Alzheimer's disease, especially the hormonal problems like thyroid hormone problems. Then there is a risk of stroke, multiple strokes, which can give rise to, and there are electrolytic imbalance, there are medication induced confusion and forgetfulness. All these things have to be ruled out by simple blood investigation. Next important investigation will be a scanning, which usually PET scan is the ideal thing to do in these patients. Third would be identifying the abnormal protein, that is beta lipoprotein and tau protein in the CSF, cerebrospinal fluid. And sometimes we also do observation of these proteins in a blood also. Nowadays, they are coming out with a blood examination for beta lipoprotein and tau proteins. So these are some tests which we do to diagnose the Alzheimer's disease. But having said that, the only 100% proof is the brain biopsy, which normally we don't do. But we more or less all these other investigations will support us. Now, Dr. Sowmya, can you just tell us what are the treatment that are available?
Yeah, so once a diagnosis of Alzheimer's disease is made, we usually start them on medications. Two commonly used medications are choline esterase inhibitors. These are medications which help to improve the cell-to-cell connectivity. The other medication is, memantine, which is an NMDA receptor antagonist. This is a medication which can help in reducing the progression of the condition. Apart from this, we use a lot of adjunctive medications like carnitine and omega-3 fatty acids and other vitamin supplements to help improve the brain functions. There's a lot of new drugs in the pipeline. A lot of research is being going on in the future treatment for Alzheimer's disease. Of course, the FDA is investigating, and approval is awaited for these medications. Most of the role of these medications is directly targeted on, clearing these abnormal proteins, the proteins that are getting aggregated. How we can clear these proteins from the brain. So, largely, these are the treatment options that are available.
Just to add up for the treatment, these treatments which are suggested are to be given in the early stage of
Yes.
Alzheimer's disease. That is what the studies have proved. If you give at a later stage, it won't be, because these abnormal proteins start to accumulate about nearly 10 to 20 years before the patient manifests with symptoms. So, picking up the patient at the early stage is the most important thing when we try to use these medications. So, it is always better to have a diagnosis at the earliest possible. Whenever you have a doubt that whether you may be having some forgetfulness, which may be attributed to many other reasons, please get it examined and consult a healthcare professional who can diagnose whether you have Alzheimer's disease like things or not. Who knows, after a few years, if the drugs are approved and if they are available in the market, one who has got an early stage of the disease can be benefited by these advanced medications. And as far as the health of the brain is concerned, I would have some suggestions for all of you to keep prevention as a measure for Alzheimer's disease and keep your healthy brain. You have to give activity to the brain. Keep giving some activity. Try to learn something new that stimulates your brain. If you are a teacher in the past, try to teach students that keeps you going, and also have a good timetable for your sleep, your exercise, and have a healthy diet. Try to manage your diabetes and hypertension at the best, and also socialize. This is one thing I want to stress all of you. Socialization is the most important thing for elderly population nowadays. We are deficient of that, so you have to have a lot of socialization which improves your brain function and keeps the brain healthy. So with this information, I am sure that all of you are aware of how to identify this disease and when to seek the medication. And hopefully, those who had lost hopes in the next coming years, you may have some hope with the new drugs. Thank you.